Hi guys, this next video is just to tell you what sort of most important 5-star level points or points you can't miss during a clinical scenario. So I would say a clinical scenario that is important to know and be familiar with is a drug rash, because we know that is, very common referral we get on the ward, and it is a nice question to ask in an interview. And I would say it's really key to differentiate between a simple drug rash as opposed to a severe cutaneous adverse reaction, an ESCAR, because it really changes how you manage them and how sort of close monitoring, how closely you monitor them and the potential for them to really go off. So I think it's really essential that you're differentiating the simple from the severe. And, you do this by looking at the patient as a whole. Are they medically stable? You're looking at their heart rate, blood pressure, temperature, respirate, all of those very important. You're looking at their blood tests, their liver function, eosinophils. You're looking at their temperature chart, their fluid status. So it's really essential knowing the difference between a simple drug rash and, for example, DRESS or, SJS or TEN. That is really essential. And I would say, being confident in knowing how to managing it and being able to differentiate those that you need to escalate to ITU compared to those that you can manage in a medical ward, or if it's a very simple one, sometimes as an outpatient. So I think involving the medical teams, ITU teams, involving your consultant is essential. And, asking about those red flag symptoms and making sure that they are examined as a whole. And of course, we're not expecting you to be the medical reg in the derm scenario, but you are still post CMT, so you should know and be able to do the basic medical assessment. So I would say that's really important, and getting the accurate, the appropriate teams involved. If it is SJS, TEN, do you need to discuss with ophthalmology? Do you need to discuss with urology? So think about the mucosal involvement. So I think, yes, being systematic in your approach, but knowing how to differentiate those key red flags is essential. The number one, I always recommend the book 100 Cases in Dermatology by Rachel Morris Jones. It's just a great book. Each page has a clinical vignette, sometimes a photograph. I know you don't always get that with the interviews these days. And then really comprehensive questions and answers on the next page, so you can really test yourself. So that's number one. Number two, you probably already know, but DermNet is amazing. We also use it as regs, as consultants. And DermNet New Zealand is the website, and it has all the different derm conditions. You can even do it by drop down, or you can search. Photos, really informative and excellent source. So I would definitely use that. And then finally, I would say BAD guidelines. So the BAD have guidelines for lots of different things, and it's really useful for the skin cancer guidelines, so melanoma guidelines, BCC, SCC management. And I'm not saying you need to memorize all of those, but it's really helpful just to have an idea, because that is what we use in clinical practice. So I would say those are my 3 top tips in terms of resources for dermatology. Of course, there's a lot more, but for the clinical scenarios, personally, that's what I would suggest.